Hi, welcome to Proven Cures. I am your host, Sarah McLeod. Today is Friday, October 18th, and you are tuned into the third installation, part 3 of my Semaglutide series. The first video I did was addressing polycystic ovarian syndrome specifically, and why I think that semaglutide is a great treatment for polycystic ovarian syndrome, because polycystic ovarian syndrome is in fact metabolic syndrome, and semaglutide reverses insulin resistance, which causes the continual cycle of androgen production associated with PCOS. So that's a really good video. If you have PCOS, you can revert back to it anytime, and give it a look. The second video addresses oral versus injectable semaglutide, the differences in dosing and side effects. It offers a general safety profile. Now, the video I'm doing today is an extension of the last video, but it is a review of an investigational study of the FDA's adverse event reporting system, database system, through which the FDA received reports of adverse events associated with semaglutide tablets, oral semaglutide, in a cohort of type 2 diabetic patients from the third quarter of 2019 to the third quarter of 2023. Because the database is dedicated to adverse events, I believe the investigators ended up analyzing some 6 million adverse events. So in order to be thorough and not have yesterday's video so lengthy, I decided I would just make this its own video. So who would be interested in this information? People, of course, who are contemplating taking oral semaglutide in the form of tablets. I don't want to say that these adverse events I'm about to share with you are attributable to all forms of oral semaglutide, because the study specifically focuses on adverse events that were reported after patients took the tablet form. So if you are thinking about taking semaglutide either sublingually as a drop under the tongue, or as a film in your cheek, the buccal film, I think is what it is, by Cheeky MD, I can't be thorough with you as far as, not in this video anyway, as far as what the adverse events would be. You see, those two modes of administration, drops and the cheek film, I'm not even sure it's a film, I just know it's something that goes inside of the cheek, are fairly I think those actually are the newest modes of administration. So there won't be a plethora of information on the side effects of using those specific forms of semaglutide. But because as far back as 2019, type 2 diabetics were being prescribed semaglutide tablets, there's quite a bit of information to look at and review. And that's what I'm going to do right now. So the title of the study is Adverse Events of Oral GLP-1 Receptor Agonist, and in parentheses they put semaglutide tablets, a real-world study based on FAERS. FAERS is an acronym, FAERS, for the FDA Adverse Event Reporting System from 2019 to 2023. It was published very recently in August of 2024, so that's just 2 months ago, in a journal titled Diabetes Therapy, Research, Treatment, and Education of Diabetes and Related Disorders. Alrighty. So, investigators basically mined the database for adverse drug events of oral semaglutide, specifically in tablet form. As I previously mentioned, data was collected from the third quarter of 2019 to the third quarter of 2023, and researchers sought to standardize the data and to do that, they used a variety of signal quantification techniques. Signal quantification techniques. Let me, give you a quick explanation what that means. So the word signal here is just another word for adverse events, which is another term for side effects. Quantification techniques is more of a statistical way of the techniques being forms of analysis, ways of grouping information and being able to generalize it to a specific patient population. The statistical techniques used here are the reported odds ratio, proportional reporting ratio. I've taken healthcare statistics, 2 courses of it, and I still don't know how to pronounce this. So if I'm mispronouncing this word, it's okay if you laugh at me. The Bayesian belief propagation neural network and multiple empirical Bayesian gamma. It could be Poisson, I don't want to say poison, whatever, contractions, which is another statistical analytical technique. But for this video, the only analysis, the ratio that I'm going to share with you is the reported odds ratio. And the reason for that is because the reported odds ratio is going to let us know in each condition group, and I'll explain that in a second, what was reported the most, which AE was reported the most frequently. So now let's dive into what the FAERS, the FDA adverse event reporting database system actually does, how it categorizes adverse events. So I worked for the FDA at one time. I was responsible for accepting complaints in their nutrition supplements division. So that's not quite pharmaceutical drugs, but if you like anything, and also food. So anything you buy over the counter, if you have an adverse event from it, you can in fact report it to the FDA, even if it's a bottle of vitamin C, whatever. If whatever you're reporting is a pharmaceutical drug, that adverse event is going to go into the FAERS database. If what you're reporting is a supplement, an over-the-counter supplement, or a food item like a bag of Doritos that made you sick, that's going to go into the CARES database. I worked in the CARES database, but both databases are kind of set up in the same way, in that they use the measure coding system, guys. So the measure coding system, what it seeks to do is classify adverse events first by organ system classes. So, let's say you had a bag of Doritos. Something was wrong with that bag of Doritos and you broke out in hives. So, and you write in and you let us know, hey, I got my bag of Doritos from this store in Nevada on this specific date, whatever, and I got hives and it made my throat swell and I had to go to the ER. So that complaint would come in and I would review it, and the first things, of course, I'm going to see there are hives and throat swelling. But it's going to be my responsibility, in order to enter it into their FDA adverse event reporting database, is to classify it by a system. So the first thing, one classification system will be dermatological, because hives affects the skin, right? And then that would be reported as an allergic adverse event in skin disorders. And the other one was what? Throat swelling. So that would be attributed to the gastrointestinal system. Okay, an allergic event in the gastrointestinal system. So that is how I'm going to explain the adverse events here. I'm going to review the table of organ classification systems and let you know which adverse events were reported per system, and I will mention first what was reported the most. That is going to make it to the top of the reported odds ratio. What I would also like to mention, well, they said here, let's see, they screened 2,398 reports, which involved a total of 5,653 adverse drug events. Because this is the FDA, most of the reports did come in from the United States. I believe some 82%. A total of 23 system organ classes were involved with 93 AEs. That is quite a bit. Now, why this is remarkable and deserved its own video, guys, is because, let me tell you, when you speak to doctors who've been giving injectable semaglutide to their patients, unless the patients have been taking the injectable semaglutide for an extended period of time, and they were not dosed up slowly, or they weren't titrated up in dosage slowly, the adverse events are kind of always the same. Nausea, some vomiting. But those adverse events can also be mitigated. They can also be lessened by suggesting that the patient hydrate properly with 2 to 3 liters of water per day. When they do titrate the doses up, like if you graduate from 0.025 milligrams and it's time for you to graduate up to 1 milligram, it's done slowly over a slow period of time. And that will mitigate other gastrointestinal problems. Also, avoiding fatty foods. The plethora of adverse events associated, however, with the tablet form of semaglutide are actually attributable to the fact that it is an oral drug. So we're thinking, oh, well, there's no pain involved. The reason why there's so much more, the risk of other AEs is so high is because with the injectable form of semaglutide, the semaglutide is going straight to your bloodstream. So the dosage doesn't have to be as high, right? But when it's taken in tablet form, the dose is considerably higher. I've actually seen it dosed all the way up to 14 milligrams, whereas with the injectable form, I haven't seen it dosed any higher than 2.5. So that lets you know that not only, am I on the right page here? Yeah. So that not only not only is the oral drug associated with more adverse events, which I'm about to share, but the adverse events come on much faster and more drastic and more harsher as well. So these are things to consider if you are contemplating what's best for you, whether you want to do a once a week injection versus an everyday tablet. What's another? Also, you might be thinking about switching. You might have started with the injection and now you're hearing that there's an oral form and you're thinking about switching. Maybe you'll see this and take this information into account, in helping you to make your decision. But it's totally up to you. It's just information, and it's public information. So the first organ class system is called metabolism and nutrition disorders. The most reported adverse event. Now, that's another thing. If you're taking semaglutide just for weight loss and not to control a diabetic condition, what may be considered an adverse event for a diabetic may not be considered an adverse event for you. And we'll discuss that as well. So the first thing here, the most reported adverse event under metabolism and nutrition disorders is ketosis at 46.87%. The next one is poor weight loss at 24.9%. The next one is food cravings at 23.13%. The next one, hyperglycemic hypersmolar non-ketotic syndrome. I don't even know what that actually is. You'd have to look that up. It's 22.43%. The next one is abnormal loss of weight. So this is, like I said, this is was a prescribed medication for type 2 diabetics. So they might be looking at abnormal loss of weight as an actual AE, whereas if you're taking it to lose weight, you might not see it as abnormal and you might not see it as an AE at all. That's what I meant. So that was reported at a rate of 12.77%, and inadequate control of diabetes mellitus at 12.67%. The next organ class here is GI disorders. The most reported AE of the GI disorders was eructation. Eructation is a fancy word for belching a lot. And that was reported at 26.43%. The next one is pancreatitis, which can be deadly if left untreated and is exceptionally painful. That was next reported at 23.12%. After that was impaired gastric emptying at 21.22%, regurgitation at 12.34%, and esophageal pain at 11.69%. Yikes. Next, we have our lab values. Lab values normally come in from clinics, or they could even come in from the manufacturer who received an inordinate amount of reports about these specific lab values, to where they are in fact obligated to inform the FDA that this has been going on with their product. So we have at the top of the list increased glycosylated hemoglobin at 22.39%, increased lipase at 19.09%, decreased blood glucose at 13.63%, which is to be expected, and increased amylase at 12.56%. Next up, we have the dreaded neoplasms. Neoplasms are growths. They can be, here they're classified as they can be benign, malignant, or unspecified, including cysts and polyps. The number one neoplasm reported was adenocarcinoma of the pancreas. That's pancreatic cancer that didn't spread at 34.16%. And the second kind of neoplasm is reported as metastatic pancreatic carcinoma, which is pancreatic cancer that spread at 21.53%. That's pretty sobering. Next up in the classification group are injuries, poisoning, and procedural complications. This I spoke to in the beginning. The number one AE in this group is drug dose titration was not performed. So that means they went from, for instance, 5 milligrams to 10 milligrams. Titration means you would take your time, 5, 7, 9. No, they just jumped from a low dose to a high dose, and of course the body was not able to tolerate that. So that was entered as an adverse event in 33.3% of patients in this category. And the second one is listed as a product package associated injury, which I don't quite get. Product packaging is in reference to labels. Product labels, label associated injuries with labels, I don't quite understand, but that is listed at 23.32%. Next in the category, general organ class system is hepatobiliary disorders. That organ class system normally includes the liver, spleen, gallbladder. The first and highest and most reported adverse event of hepatobiliary disorders is acute cholecystitis, which is inflammation of the gallbladder, at 50.41%. And after that, bile duct stones at 25.33%. After that, now the organ class are eye disorders. Of that group, we have 27.89% reported diabetic retinopathy and 20.54% reported vitreous hemorrhage. Yikes. On to endocrine disorders, which makes sense because we're talking about with semaglutide being a hormone mimic. So for that to affect the endocrine system makes perfect sense. The most reported AE in this group are thyroid cysts at 70, whopping 70%. And the next one is thyroid masses at 14.26%. The next group are renal, which is another word for kidney, and urinary disorders. And the only reported AE in this group was renal pain, kidney pain, at 13.15%. Next step, we're in the respiratory, thoracic, and mediastinal disorder classification. And VIF nerve paralysis was reported here at 40.88%. Next up, we're in the classification of psychiatric disorders. And the AE listed is neck mass, which doesn't make full sense to me. It's like saying, oh, I'm having a disorder, a cognitive disorder that's attributable to a neck mass. Not quite sure how they came up with that distinction there. But sometimes mistakes are entered into the system because maybe whoever entered the information in was not able to figure out where to place a neck mass. That could very well have gone under endocrine. They could have also gone under neoplasms, but who knows? I don't have the complaint before me to make that determination. That's actually work I used to do. That's why I'm saying what I'm saying, because I was responsible for making the distinction between symptoms and clinical conditions for entry into the adverse events system. So that's why that stands out to me. But yeah, so 26.28% reported a neck mass. After that, we have another thing that doesn't make sense. Off bat, it's the musculoskeletal and connective tissue disorder group, and the AE is early satiety. First of all, if you're taking semaglutide to lose weight, early satiety is definitely not an AE, right? Because early satiety means you get full faster off of what you eat, so you end up eating less. That's what early satiety means. But that, if considered an adverse event, that would be definitely attributed to or classified in the gastrointestinal disorder group, not musculoskeletal at all. So there we go. That's reported at 25.35%. The last one is infections and infestations. And the AE listed for that is positional vertigo. Positional vertigo means, sudden movement of the head, maybe from here to here, or from laying down to getting up really fast and you feel dizzy. That's positional vertigo. It can be a side effect of an infection. It can. That can happen because you have a sinus infection or you have a cold or something like that. But I normally don't see it classified there under infections, but it can make sense in that regard. So that was reported at 21.73%. Okay, dokie. So of all the AEs for the oral semaglutide. So that basically wraps up what I wanted to cover here. Side effects of semaglutide tablet intake. At the end of this video, guys, as I've stated in other videos, I'm just coming back after a hiatus to the channel. And when I was away, I was designing sportswear. I got my own store going and made it into some really high fashion editorial magazines. I really, would appreciate you guys going over and having a look. I'm going to put a link in the description. I need to put that link in all my descriptions. But check it out. Anyways, like, share, subscribe. Next, I had some other stuff I wanted to share, but one of my viewers asked for information on Gymnema Sylvester, so I'm actually going to take the time after this video and do some research, see what I can find regarding a clinical trial surrounding that nutraceutical, that herb. So that's that's going to be my next video, because I'm positive I'm going to find some good stuff, because that's a very good herb to keep blood sugar under control. So yeah, like, share, subscribe. Thank you for tuning in. Thank you for having faith in me. Thank you, my longtime subscribers. Thanks for coming back and watching again. Yeah, and I hope you enjoy my ad. Later.